Support for Carolina Business Review provided by Grant Thornton. Operating in more than 100 countries, our tax, audit, and advisory professionals specialize in helping companies unlock their growth potential. Blue Cross and Blue Shield of South Carolina, where healthcare is changing for the better. Find out how at ahealthysc.tv. And by Sunoco, a global manufacturer of consumer and industrial packaging products and provider of packaging services, with more than 300 operations in 35 countries.
So statistical evidence says that this current economic expansion is the fourth longest in well over a century and a half. It's closing in on 87 months now. Hello, I'm Chris William, and this is the most widely watched source of Carolina business and public policy, seen for 25 years now across North and South Carolina. Thank you for joining us and supporting us. And by most measures, things are pretty good. Consumer confidence is at a high water mark. Unemployment in our region is dropping at below the national average. Cost of money, the cost of energy, including gas, is still cheap. Even wage growth has shown 2 years of increases and forecast for another year of growth this year. So how does all of this play out in government and business activity here? Well, we'll ask some experts again. And later on, North Carolina Budget Director Drew Heath.
Major funding also by Novant Health, bringing you world-class technology, clinicians, and care when and where you need it. The Duke Endowment, a private foundation enriching communities in the Carolinas through higher education, healthcare, rural churches, and children's services. And by Blue Cross and Blue Shield of North Carolina. Who's responsible for rising healthcare costs? Join us and many others in a candid discussion at letstalkcost.com. On this edition of Carolina Business Review, Linda Millsaps from the North Carolina Association of County Commissioners, Ted Pitts of the South Carolina Chamber of Commerce, and special guest Andrew Heath, North Carolina Budget Director.
Welcome to our program. Happy fall, folks. It's hard to believe summer's already blown by. Linda, good to have you here. Ted, welcome back. Linda, interesting. You just came out of an enclave of all the county commissioners in North Carolina, 100 counties. That had to be a gang, and there had to be some real jawboning going on there. What were the issues? Here we are, a pretty good economy, right? Very long economy now. What were the real concerns from county commissioners that came out of that?
Chris, I think it was, well, first of all, thanks for having us today, having me today. And in terms of the things that came up, kind of to segue to the economic concerns, a lot of people are excited about the amount of growth we've seen in some areas. Some folks have some concerns about how do we manage that growth to keep the character of the state that we have while still have jobs. And on the other end, of course, how do we create jobs and economic growth and vitality in some of our more small rural areas. But our issues kind of go beyond that because, as you know, in North Carolina, county government is where services are delivered, education is delivered. And so how to pay for those kind of things and how to best manage those, especially things around mental health and K-12 education, have been some of the highest policy priorities for our members.
Can you think of, is there a, it's easy, and this is not fair because I asked you this question, but it's easy to say these are our concerns, but were there any real solutions? Did they say, if Governor McCrory or the General Assembly or whatever, if we could just do X, then Y would happen?
Well, unfortunately, none of us determined a magic bullet. So I guess that's kind of the first thing. I think what's really exciting about the commissioners as a group is we have a lot of people who have been very committed as commissioners for a long time. Our current president, Fred McClure, has 20 years as a county commissioner, so they have a long view on things. And I think a lot of what they're looking at is maybe re-examining a little bit about how education should be funded. And what makes the most sense for that. There is an enormous amount of concern, as I said, around mental health issues. and how that should be delivered. And I'm not sure we have a magic bullet for that, except for we know we really need to focus a lot on substance abuse issues and think a lot about how we structure mental health treatment going forward. In economic development, where we see a lot of the challenges have been, we have more than 20 counties that really have no industrial sites that are truly available, shovel ready to go. And we also have a lot of counties that don't have a lot of broadband access. And even counties that you would think have broadband don't have broadband countywide. For example, Pitt County, home to Greenville and ECU, if you go to the northern end of Pitt County, there's no broadband access. And all of those things are infrastructure items that really impede economic growth. So I think we have a lot of interest in trying to find ways for the more urban and rural counties to really work together going forward to kind of manage our own destiny collectively about how do we grow the state in each of the individual counties.
So Ted, I think of South Carolina, and as you listen to your North Carolina cousins here talk about the debate in some of the poorer counties, that's got to ring true with you, especially Colleton, Hampton, some of those counties that really struggle with high unemployment rates. Is there an answer to this?
You know, I don't know that there's an answer, but there is a lot of conversation around the issues. You know, when you look at tax base and just in general, we have some places that are growing extremely fast. Charleston County is growing 60 people a day, permanent residency. So you see that sort of growth and the impact that growth has on schools and services. But then you go to the other end, and we have regions of the state that that continue to decline, and the tax base just isn't there to support services. So it is a troubling kind of conversation to have, that in South Carolina and North Carolina as well, as we're seeing some rapid population growth in certain areas and some dynamic things happening in those areas. But then in other parts of the state, you know, rural South Carolina and North Carolina, we've still got to focus on providing solutions to their problems.
So let's stay with the Low Country for just a second, because Charleston is clearly one of the hottest countries or one of the hottest markets in the country. Would transportation go a long way in helping Charleston, Dorchester counties share their wealth and good fortune with those poorer counties to the south? Is transportation a big answer to the question? So,
I mean, when you look at the state as a whole, you know, our infrastructure system obviously needs a lot of capacity improvements, as well as just maintenance and conditions being brought up to standard. So, you know, that is an issue obviously that's on the forefront. But, you know, when you look at the issues that rural South Carolina struggles with, you know, some of it's health care related, education, you know, issues, where you just don't have the capacity to deliver the service efficiently, really, to the population that's there. So we continue to work on those issues, whether it's education or transportation, or, you know, on some health care on some fronts, when it comes to trying to solve problems for all of South Carolina.
Linda, if all the county commissioners in North Carolina, as you just had your group get together, if they had an audience with the General Assembly and all the General Assembly did was listen to them, what one thing could they say that would make a difference in General Assembly looking at not just funding formula for transportation or education, but what do you think the county commissioners would say to the General Assembly that would be important to do and to remember?
I think one of the things that would be most important is to address the historic partnership. You know, in North Carolina, local government in many ways is the hands and feet of state government. And so how can we make sure that relationship works as efficiently and effectively as possible? And how can the state help us support some of these new pilots, new ideas, some of which are being tried, some of which aren't, that maybe could be carried out into some other communities? I think that would be really helpful. And also some additional assistance just in general of helping some of those smaller, poor communities grow. All of our largest counties, you know, Wake and Mecklenburg folks will be happy to tell you that they understand that places like Greene and Jones County and some of our small places, that they have challenges, and they want to also do what they can. And of course, you know, work with their own people, but they want to address that too. So,
do you feel like, not to put you on the spot, but do you feel like counties and county commission, bodies of county commissions, do do they still feel like Raleigh and Jones Street overreaches and reaches into what kind of into their business? Is that still a tender feeling?
Well, I think that will probably always be a tender feeling, right? You always, that's kind of how that always goes. But I think there's a lot of opportunity for really good partnership there. We've recently done some work around processing for public assistance with the state. And as a result of that really strong partnership on one particular issue, we've been able to make some really substantial improvements. And so I think the more that we can get everyone to work together and really hear each other's concerns and how we can address problems will go a long way.
In about a minute, Ted, ethics reform in South Carolina has been talked about for a while. There's an ethics commission that was separate that kind of followed what happened with Bobby Harrell in the General Assembly. I'm not going to ask you about that per se, but is ethics reform going to get some traction and have a solution, or at least have an outcome?
Yeah, so last year they passed 2 bills. One of them set up an independent investigatory body, so no longer will the House Ethics Committee investigate House members and Senate Ethics Committee investigate senators. So that was key. And then also income disclosure, not the amounts, but sources of income, who pays you, is going to go into effect this year. So there has been some movement in both the House and the Senate to shore up our position when it comes to ethics laws. Is
the general sense that's not enough, but it's enough for now?
No, I think the general consensus is that let's implement these provisions and see how it works, and if we need to tweak it later on, we can. But I think everybody is pleased that the General Assembly stepped forward and dealt with ethics reform with those 2 proposals.
Okay. Guys, thanks for being on the program. We're going to meet our guest here in just a moment. Next week on a program, it's kind of fancy and fun and even tabloidy to say that she is the highest paid CEO in the Carolinas, corporate CEO. But could be deserved. Her company, Premier, used to be called Premier Healthcare, has done some wonderful things. Susan DeVore will be our guest next week on this program, talking about healthcare from a partnership standpoint and what that means. And then in 2 weeks, he is the president of BB&T for North and South Carolina. Ricky Brown will be on this program as well. The state's budget office is charged to objectively, clinically, and practically deliver a budget to our highest public servants, the governor, the legislature, and state agencies, but moreover, to provide clear thinking and recommendations on how to best apply and execute these annual public financial plans. Joining us now is North Carolina State Budget Director Andrew Heath. Drew, welcome to the program. Nice to have you here.
Thanks for having me.
By the way, congratulations, I'm assuming, on this new role, right?
Depends on the day.
Yeah, I'm sure.
But thank you very much.
Again, welcome, Drew. So here we have, session's been over now for a while, had a good budget, seemed that there has been some surplus. A lot of this got lost in some of the social debate that's gone on in North Carolina. But as you kind of sit now over running a budget and recommending a budget to these agencies and those in charge, and you see these revenues start to come in, what's your observation? You've got a new set of eyes, you watching revenues come in now. What's different now? Maybe what's unexpected, or what would you say?
What really struck me when I came on is how much revenue we're gaining even in an environment where we've cut both corporate and personal income taxes pretty severely. So when I first came on in February, the projected revenue for the 15-16 fiscal year was $237 million. And that's the budget that we put together, was based on that figure. And then by the time the year-end figures came out, we ended up with a $430 million revenue surplus. So higher than anticipated income tax collection, personal income tax drove that. I think we ended up $600 million more than we thought we would have from personal income tax. And that was driven by the tremendous job creation that we've had in the past 3 years or so, about 300,000 net new jobs in North Carolina. So that's really what struck me. And then, so you saw this climbing, higher than anticipated revenue collections, and it's very early in this next fiscal year, but we sort of see that trend continuing based on the first 2 months of revenue collection so far.
So you think that's sustainable? That kind of growth in personal income is sustainable? And do you think, if that's the case, then that becomes a bigger target for the General Assembly next year to look at?
Yeah, so you want to make sure that if we're going to have climbing revenues, that we're responsible in our spending, and you saw some of that reflected in this last budget. I think that sort of attitude remains, that if we do have strong revenues. We'll invest them into repair and renovations, into the state's rainy day fund to make sure if we have a future economic downturn, we'll be prepared. And then some targeted investments like teacher pay and things like that. So, as you look for, you don't have a crystal ball. The longer you try to project things out, the less, the less accurate you're going to be. But as we look for the next 6 months or so, I feel like things are looking good for North Carolina's economy. If you look at housing permits that are being pulled, if you look at manufacturing, the number of hours and the wages that they're being paid remains pretty strong right now. So I think we can continue to see, some continued growth in North Carolina.
Linda?
My question relates, I guess, to, we talked about some of the counties that aren't doing as well as others, and you obviously see that from the sales tax numbers you look at. From a budget director standpoint, how do you see as some of the ways the state has been and hopefully could be in the future more helpful to some of those areas, and also to some of our larger counties that their schools are bursting at the seams, some of those kind of issues?
Sure. So with respect to the sort of non-population centers, what we're trying to do is generally put in place reforms that are going to benefit everybody, all 100 counties. We want to be 100 counties strong. This Carolina comeback should reach everyone. And so you see the personal income tax rate down from 7.75% to 5.499 beginning January 1st. Corporate income tax down from 6.9% to 3%, which will be the lowest in the country among states that have that type of tax. The unemployment rate is down in all 100 counties. So we're trying to put in place reforms that benefit everybody so that all ships will kind of rise with the tide. And then I sit on the Economic Investment Committee, the JDIG grants that go out. The state Department of Commerce is working very closely with regional and local economic development partnerships to try to bring jobs wherever we can across the state. You don't hear about every job announcement. We gain about 230 jobs a day in North Carolina, and those do go to the rural counties. A big one, the CSX intermodal terminal is going to bring thousands of jobs to Ashe and Edgecombe County, so that'll be a boon to that area. The distribution center for Walmart in Mebane, that'll bring a tremendous amount of jobs. So I think we're starting to see some of this activity, outside of Wake and Mecklenburg County.
Not to put you on the spot, do you do any pro forma on that Walmart plan as well as the CSX plan? Do you know what kind of revenue that could add on and above what we already have?
In terms of revenue collections for the state?
Yeah.
Well, in a $500 billion annual GDP economy, those will eventually make a splash, but I don't know that they'll have a near-term measurable effect.
And it doesn't give you a chance to go to your research group and say, hey, listen, what is this doing? So I understand that.
But that's not to say, it will be huge for those regions of the state.
Okay.
Yeah.
Sorry, Ted, go ahead.
Yeah, Drew, first of all, North Carolina gets credit for cutting taxes. I think that's a good thing. I think it does spur the economy. When you look at kind of the breakdown of the revenue growth you've seen, you talked about personal income taxes. What other revenue streams do you see showing a marketable increase?
Sure. So corporate income taxes are up, but we were under projections actually by just under $40 million on corporate income taxes. And then some of the repair maintenance, those kind of service taxes, the new sales taxes, those were under projections by about 180 million. So, we're still seeing growth in those areas for revenue, but the huge driver is the personal income tax.
And is it driven because of the population increase, because of the workers coming to North Carolina to take these jobs, or is it driven just because of income levels?
So wages are up, so there's, those dollars are being taxed, and then 300,000 new jobs, just to put it in perspective, is like a job for every resident of the city of Greensboro, one of our major cities in the state. Having that revenue base just come online in a relatively short period of time really is driving, some of that revenue.
So what's the landmine? What do you say, yeah, it's all working now, but I can see on the horizon something that could be a problem?
So I think a big problem, and you mentioned the national economic expansion that we've experienced, 86 months, 87 months. But it's also been the slowest economic expansion since post World War II.
But that's not bad necessarily, right?
It's not bad. It's never bad to be expanding, but it's just not keeping the pace that we've seen in other economic expansions. And I would argue that, and I think some data supports this, is that overregulation has hampered what could be even stronger growth. So I think the Federal Budget Office took a look at regulations, and just the regulations that came on in the last 10 years are costing the national economy about $100 billion a year. So imagine if that monkey was off the back of our businesses.
Excuse me, is this Dodd-Frank?
I'm sure it has a lot to do with Dodd-Frank.
It's EPA. I mean,
EPA,
the federal regulations impact on businesses is real.
Okay.
And then I've been talking with some small business owners this week, and the number one by far concern that they have is increasing health insurance premium costs. So as the Affordable Care Act comes online, they're looking at 30% increases in their premiums that they want to provide health care for their employees. But that is a huge cost. I mean, it wipes out a lot of the really good things that have been done for small businesses, so.
Linda?
Well, and that kind of gets to, both of those comments get to some of the concerns the counties have. As you noted, the sales tax numbers, of course, for counties, sales tax and property taxes are our primary revenue sources. And the sales tax numbers didn't come in as expected. So maybe if you have some thoughts around, is that going to get any better? Or do we continue to tell the counties that, no, it looks like things are just going to be a little bit lower? And then related to that, we have a lot of expenses, I mentioned earlier, around mental health, and that's going to continue to be the case. It's not just business that has to manage the cost of health care. Local governments have to manage the cost of health care either through county hospitals or through their administration of Medicaid or the public health programs. So if you have any thoughts around that as well.
Sure. I mean, health care costs are projected to continue to climb. I sit on the state health plan, thank goodness, as a non-voting member, but I do get the privilege of reviewing those things. And so we've done things as a state to try to reduce the year-over-year growth that we had projected. And we're getting it down to about 4% over the next biennium, 4% growth, and that's down from like double-digit projections. So what we've done is we're trying to maximize drug rebates. We put in place a drug formulary, just how we're just rethinking the whole approach with the state health plan. Small businesses, local governments are going to have to do the same thing. It's going to happen. The costs are going to rise. We just need to examine how we're treating healthcare. With respect to the sales tax, I think that is still, it's going to continue to be a reliable revenue source for local governments. And while we were under projection, on the state level, it was $37 million in a state as large as ours. That wasn't a huge reduction. I think I'd use that statistic to point out that what was driving our revenue surplus wasn't sales tax. So I think it's still a reliable stream of revenue.
We have about a minute left, Ted.
When you talk about the health system, but you talk about pensions. In South Carolina, the pension, the unfunded liability has been an issue that's kind of popped up here again over the last year. The General Assembly passed a bill in 2012 that dealt with it in South Carolina, and now the issue continues to be something that we have to deal with. As far as pensions go in North Carolina, are y'all seeing a similar situation? Is it something that folks need to be worried about? I know the business community is very concerned that the state of South Carolina keep its AAA credit rating, and the way that looks in North Carolina. What do you see? And
you have less than a minute.
Sure. Yeah. I mean, we don't want. We're aware of that issue. We care about our AAA credit rating as well, and it is an issue that we're going to have to tackle at some point. We certainly don't want to turn into an Illinois or some of these other states that just have unsustainable pension programs. So it's definitely on the minds of
yeah, and I know, Drew, we ought to be asking the treasurer this question, but we're not close to the edge on a AAA rating. We're not close to the edge of bumping up against a limit on debt issuance in North Carolina.
No, the Debt Affordability Advisory Council or Committee, when we issued the $2 billion Connect NC bond, said that we could probably borrow somewhere around $4 billion.
Okay.
But we don't want to take our AAA rating for granted either, So. Right. And just finally, another helpful item for local businesses is a Connect NC bond.
Okay, it's got to end there. Sure. I'm sorry, I wish we had Connect NC bonds. We didn't talk about that with you. So would you come back and talk about it?
I'd love to, anytime.
Thank you. Congratulations on the job. Glad you're in it.
Thanks
Ted,
a lot.
good to see you. Thanks for being on the program. Linda, thank you. Till next week, I'm Chris William. Good night.
Major funding for Carolina Business Review was provided by the Duke Endowment, a private foundation enriching communities in the Carolinas through higher education, healthcare, rural churches, and children's services. Blue Cross and Blue Shield of North Carolina. Who's responsible for rising healthcare costs? Join us and many others in a candid discussion at letstalkcost.com. Grant Thornton. Operating in more than 100 countries, our tax, audit, and advisory professionals specialize in helping companies unlock their growth potential. Novant Health, bringing you world-class technology, clinicians, and care, when and where you need it. Sunoco, a global manufacturer of consumer and industrial packaging products and provider of packaging services, with more than 300 operations in 35 countries. Blue Cross and Blue Shield of South Carolina, where healthcare is changing for the better. Find out how at ahealthysc.tv. And by viewers like you. Thank you. Promotional consideration provided by Business North Carolina Magazine. For more information, visit carolinabusinessreview.org.